Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rao. This is the show where we get you all the latest COVID news. Well, let's first take a look at the data, and 41,806 new cases have been reported in India in the last 24 hours. That's 7.7% higher than yesterday. 581 deaths were recorded in the last 24 hours. The daily positivity rate is 2.15%, less than 3% for 24 consecutive days now. But this has been the biggest jump in active cases since the 1st of June. If we now take a look at the vaccination numbers, then India has vaccinated 39.1 crores so far. Yesterday, 34,97,058 vaccinations took place in 24 hours, which is much lower than what India should be vaccinating every day. 86 lakh, at least India should be vaccinating every day if we're to reach that 60% of our population being inoculated by December, which is the aim. And once again, the top states that are contributing to the surge in cases are Maharashtra, Kerala and Andhra Pradesh. Kerala reporting 15,637 cases, followed by Maharashtra there with over 8,600 cases, followed by Andhra Pradesh with 2,591 cases being reported. Now, amid the concern over the increase in the R-factor reproduction rate of coronavirus in some states and union territories, the Home Ministry issued an advisory urging governments to ensure members of the public follow COVID protocol. So what is the R number, R factor? It's the reproduction number of a virus, which tells us how easily it spreads in a population. And it's the average number of people who will get the virus from an infected person. Currently, it's 0.95 in India. Well, to talk more about this, we're joined by Dr. Anita Ramesh Chandra. Thank you so much, Doctor, for joining us again on the program. If you can explain to us, what is the R factor and how does one measure it?
See, to the reproductive rate, suppose if the R factor is 1, that means we 100% spread. If 100 people can spread 100% spread of the virus is there, the virus reproduces and it carries 100%. Now, if you see, now, as you correctly said, now the R factor is less than 1, means our spread has become little less. But if you see the data in March and April, it was in the second it started, we had our
All right, we seem to be having a problem there with Dr. Chandra. We're just going to try and reconnect with her. But talking about the R factor, and what's worrying right now is that it's at a 0.95, and this is the level that we had reached in February. Our factor had risen at that time to 0.95, and do remember that was just before the second wave of COVID, and that's just before we saw the numbers, the rate of infections increasing and the cases increasing rapidly following that. In fact, at that time in February, when the R factor had reached 0.95, the number of cases were around 12 to 13,000 a day, so they were much lower. And now the R factor is at 0.95, and cases are averaging around 40,000 a day. So that's a big worry, especially since we've been talking about a possibility of a third wave. We know that the Prime Minister, the government has been warning the public against carelessness, against going into crowded areas, and especially after pictures have been going viral from hill stations and other areas of massive crowds of people. We do know Uttarakhand too has cancelled the Kavariya Yatra this year because of the COVID worries and because we were still in the midst of the pandemic. So there you can see the R factor, which is at 0.95 currently, how it's come up in the last month or so. It's increased and is just below 1, and if it goes over 1, what most experts say is that then the numbers start rising rapidly, and some states are also reporting higher R factor levels, especially in the northeast. Recently, the Prime Minister held a meeting as well with the chief ministers of northeastern states, where the number of cases is going up and the R factor is also over 1. Well, we have Dr. Chandra back with us. Yes, doctor, you're telling us about, the reasons why there's such a concern over R factor and how is it calculated?
Hello?
Yes, doctor, go ahead.
Yeah. So, is that the R factor is the reproductive rate of the virus. That means how far the virus is spreading from one person to another person, where 1 means that there is 100 people infected and 100 people spread takes place. So that is the R thing. If the R factor is less than 100, or it is less than 1, it means that the reproductive rate or the spread of the virus is much lesser. Like you rightly say, 0.95 to 0.97 is the present rate of R factor. Now, if the R factor goes above 1, as you know, which have happened in April and May, that means the spread of the virus is very fast and the infection is getting spread from one person to another person very rapidly. And so the infectivity was high, and that's what happened in the second wave. Now, what is the importance of R factor today? Because this gives you a trend whether the next wave is coming or not and what has happened to the present wave. Now, you see that the R factor is decreasing now, but in some states as Kerala, Northeast like Mizoram, Tripura, Arunachal Pradesh, the R factor is still more than 1. It's 1.1, 1.09 at several places in Northeast, which is very alarming at this point of time because that shows that the cases are rising, infectivity high is in Northeast, whether pilgrimage, whether hill station, outing, or other factors have contributed it. It gives you an early trend. Are we getting into the third wave? That's what it is alarming. So,
right.
And I think the Prime Minister already addressed the nation because that R factor was taken into account, and then we had wanted to curb what is happening in the northeastern part of the country. Okay, so that's the importance of R factor. Though the whole country is showing a decreasing trend, but there is an increasing trend in Kerala and the northeastern India, which gives you a clue, yes, might be a third wave can be knocking at the door.
All right, so that is the big worry. The other worry is also that active cases have jumped today over, the highest jump that we've seen since the 1st of June. So clearly we have to keep a watch and be very, very cautious. And as the Prime Minister said, it's the public that must be very cautious and keep following all the COVID protocol. Thank you so much, Dr. Chandra, for joining us on the program. Well, let's now talk about COVID variants and the importance of identifying and tracking these variants. Remember, the Delta variant is going on to become a dominant variant across the world, not just in India. We're now joined by Dr. Aditi Hazra, Genomic Epidemiologist, Assistant Professor of Medicine, Harvard Medical School. Thank you so much for joining us. If you could explain, to the viewers, how does genomic sequencing help in the fight against COVID?
Genomic sequencing looks at the complete set of genes in the coronavirus. Instead of just doing a diagnostic test that tells you if the virus is present, the genomic sequence can tell you the characteristics and behavior. So which variant is more transmissible? Does it have a more severe symptoms or severe disease? And does it impact the immune response or vaccine escape? So these are 3 critical reasons we need to sequence the virus to better track the existing variants, such as the Delta variant, to identify new, more transmissible variants, and to implement mitigation in local regions that may have an outbreak or a cluster.
And so what are your concerns currently when you see the situation here in India? The cases have been coming down, but the vaccine rates are also going very slow.
My concern is about the spread in areas of low vaccination. The Delta variant is more transmissible. There are other emerging variants such as the Delta Plus, and it is in the areas of low vaccination in rural India that I am most concerned about future spread.
So currently the Delta variant is spreading rapidly across the world. In fact, the World Health Organization has even said it's on its way to becoming the dominant strain. If you could explain, why is that?
Sure. So it becomes a dominant strain by outrunning or outcompeting the other variants that are in circulation. The original strain of the SARS-CoV-2 virus infected about 2 to 3 people. The Alpha variant infected about 4 to 5 people. We are seeing that the Delta variant infects about 5 to 8 people for one person that is carrying the virus. So it is more transmissible, and it may impact the immune escape as well. So we need people to get both doses of the vaccine and then allow their antibodies to rise to the peak levels 2 weeks after the vaccinations to be fully protected.
And are we sure yet that the Delta variant is causing more severe disease? We know it's more infectious. There's also concern about the efficacy of the variant, of the vaccine against this particular variant.
I think that we are seeing that it is more transmissible or more infectious. We are not seeing that the severity varies. But what we are seeing is that there is a slight decrease in efficacy, but the vaccines still remain effective. If we think about the vaccines that we started with, they had such a high efficacy. So even a slight reduction, it's still providing strong efficacy with both doses.
And is it possible going forward, Doctor, if the virus mutates and actually becomes weaker? So far, we have been seeing it becoming stronger, or will it, will this always be the case?
So if the virus mutates and becomes weaker, then maybe it becomes less transmissible as more people are vaccinated. But in areas of low vaccination, it can still spread. As it spreads, it's copying itself in the human cells, and that's when it has an opportunity to change or mutate. It creates sort of an error in its copy. And these mutations sometimes, as you said, can be weaker, but other times it can give the virus a transmission advantage. So it's spreading faster. And what we are most concerned about is that if the mutation affects the spike protein of the virus and impacts its immune response or vaccine effectiveness, then that can create more chaos.
All right, and in line with that, my next question about vaccine and equity that we're seeing in the world, which is a huge concern right now, and how this can actually lead to the emergence of new variants, in different parts of the world, and that's a risk for everyone.
Absolutely. No country is safe until we are all safe. The vaccine is a shot of hope and a shot of science. We need vaccine equity. We need to share doses. We need to implement strategies to get the vaccine to rural parts of the world. And we need to make sure that we vaccinate and remind people to come back for their second dose. Or we have here in the US implemented door-to-door services as well. We need to meet the people where they are in rural parts of India and make sure everyone has access to the vaccines.
All right, thank you so much, Dr. Hazra, for joining us on the program. Well, let's now focus on Europe and take a look at the situation there, as countries are seeing a surge in COVID cases and governments want to implement new strategies to get people vaccinated, and those strategies vary from one country to the other. Well, to talk more about this, we're now joined by Emmanuel Chase from DW in Berlin. Thank you so much for joining us, Emmanuel. First and foremost, we have seen a surge in COVID cases in European countries. What's the situation like?
Overall in Europe, we see a surge in Delta variant cases at a time when people are moving around quite a lot due to summer holidays. Here in Germany, the incidence rate is on the rise again, not to a dramatic level at around 7 new infections per 100,000 inhabitants, but still enough of a worry to prompt discussions as to how to contain this surge, how to prevent a fourth wave of infections. One of the key factors to try and curb those new infections being vaccination. And here in Europe, the vaccination has indeed picked up, but there's still reason to worry. If you look at the Netherlands, for example, well, there is a 500% spike in the number of coronavirus infections recorded this week only, and this comes after the government's decision to scrap nearly all restrictions in late June.
And one of the most controversial measures is making the vaccine mandatory. Can that be the case?
French President Emmanuel Macron announced that a vaccine would become mandatory for medical personnel and that a sanitary pass would be necessary to access places of socialization, restaurants, cultural events, and this in fact prompted 1.3 million people to register for a vaccination on the very same evening of the announcement. Mandatory vaccination is also being imposed in Greece for nursing home staff and health workers, and the country is even offering incentives such as money or free mobile data to try and get more people getting vaccinated. Here in Germany, Chancellor Angela Merkel said it would not become mandatory, but she advocated a more pedagogical approach to get more people willingly taking the jab.
All right, Emmanuel, thank you so much for joining us here on the program. With that, time for us to slip into a short break. On the other side, we'll get you questions that you often ask about vaccines, about the new mRNA vaccines, and Dr. Rajneesh Kumar will answer those questions. Now, for our special campaign, Vaccinate India, in partnership with Google, where we talk about questions that a lot of you have about the vaccines, about COVID, questions that you often Google. And to answer them, we're joined by Dr. Rajneesh Kumar, HOD Neurology, Paras Hospital, Gurgaon. Thank you so much, Doctor, for joining us. And people have a lot of questions about the vaccines, and especially now when there's talk of the Moderna vaccine coming to India, many people are looking up, how do mRNA vaccines work?
Good afternoon, everyone. You know, the mRNA vaccines, they work by introducing a small piece of mRNA that corresponds to the viral protein. So this is a small part of protein which is found on the virus outer membrane. So what happens is, as a part of a normal immune response, the immune system, it recognizes the protein as being foreign and produce specialized proteins which are known as antibodies. Antibodies, these help protect the bodies against infection by recognizing the individual viruses and other pathogens which are attached to them, and helps in their destruction. Once produced, the antibodies, they remain in our body even after the body has rid itself of the pathogen, so that the immune system can quickly respond if it is exposed again. So what happens if a person is exposed to a virus after receiving an mRNA vaccination, antibodies, they quickly recognize it, attach it, and causes the destruction. So it prevents our serious illnesses. So it is helping out by this process.
All right, and these are known as the modern vaccines using new technology. And how do they compare? Should we not compare with the vaccines that we're currently using in India?
You know, we do not have a lot of studies, you know, which are head-on studies. So if we see all of them, they're working on different ways and producing antibodies. So generally, if you do not have a very head-to-head study, you cannot really compare them one directly to the other. But whenever we see all these, the vaccines which have come, we have seen that there have efficacies around 80, 85%, 90%. So as time goes on, we will be knowing about the efficacy in a better way, about the protection, about, you know, whether we will be needing a second dose or a booster dose. So they will all be seen once we have a long-term study. We are seeing the vaccine for about 6 months and years. So that will give us some better information regarding.
All right, and basically all the vaccines we currently have are effective against COVID. They do provide protection. Another question that people often look up is about the antibodies, and people often want to know that does the presence of antibodies mean that you are immune to COVID?
No, you know, what happened is, you know, after first dose also and the second dose also, your antibody production, they start take place. People, you know, when we started off, we started with, you know, the vaccines being given at a 1 month interval period of time, and then it was slowly increased, because when you had the studies, you found that when it was given at a later period of time, the efficacy was better. So what happens is, it's not that, you know, if I have infections also, and if I get the vaccine also, our antibody production happens. The maximum antibody production is seen at about 2 weeks period of time. But still, you know, if you see that I've got a very high antibody, so I've got a good response, it's not basically correlates directly with it. We just need to vaccinate, you know, because the tests are also, as day progresses, would become much more effective, to become much more sensitive to just say, which person have got a better immunity and the other has lower immunity. But at this moment of time, they do not tell us that, if I have this much of an antibody, it's good. If I have this less of an antibody, it's good. Because different trials, and different studies have shown that antibodies production doesn't correlate well with the infections or with the immunizations. So you do not have anything, which has got a direct or a proportional relationship with them.
Right. So you say people shouldn't get into this trap of constantly, getting themselves tested and checking their antibodies, and also getting very worried if the antibody count goes down.
Absolutely. We should not get worried about it.
All right. And doctor, another question that people often have is that, the antibodies that you get after an infection, how does it compare to the antibodies that you get after a vaccine?
So there is no any trials or anything that tells us, that, at this, when you have an infection, your antibody production is more, or when you are having a vaccine, the antibody production is more. So there's nothing like that. And still, it's very early days to really compare up both the things. And we should not worry a lot about them. We should be worrying more about vaccinating as many people as possible.
No, that's absolutely right. Right now, the big challenge is to vaccinate people and, not worry about the antibodies or even about booster shots at this point. Thank you so much, Dr. Rajesh Kumar, for joining us on the program.
Thank you, ma'am. Thank you, ma'am.